Imagine this. What if one tiny pill was quietly shrinking your brain? Not after years, but in just 3 months. Every day, millions of seniors take medications they trust for allergies, anxiety, sleep, and blood pressure. But a wave of new research is exposing a dark truth. Some of these medications may be silently triggering memory loss, confusion, and even dementia long before anyone notices. A recent review found that several popular medications, many prescribed to seniors, increase dementia risk by up to 80%. The worst part is that most of these prescriptions are considered safe by many doctors and are still handed out daily. In this video, we will reveal the 9 medications linked to cognitive decline, including the one associated with the most aggressive brain shrinkage ever recorded in seniors. If you or someone you love takes any of these, you need to know what's really at stake and what to ask your doctor before it's too late. Let's begin with number 1. Opioids. 1. Opioids. Opioids are among the most commonly prescribed medications for pain relief, especially after surgeries or injuries. Common opioids include oxycodone, hydrocodone, morphine, and Vicodin. These drugs are intended to provide relief from severe pain, but they come with significant risks to the brain. Let's look at Sheila's story. 3 years before her diagnosis, 72-year-old Sheila was prescribed oxycodone after a knee replacement. At first, it was just for pain, but she kept refilling the prescription. Over time, she began feeling foggy and disoriented. She once asked why her bed was floating and forgot how to unlock her front door. Her husband noticed she was quieter, slower, and would zone out mid-sentence. 3 years later, her neurologist confirmed early-onset dementia. Opioids work by binding to receptors in the brain that block pain, but they also affect the areas of the brain responsible for memory, mood, and cognitive function. The long-term use of opioids suppresses brain function in ways that go unnoticed for years. Studies show that chronic opioid use accelerates cognitive decline by up to 40%. These drugs don't just numb pain, they suppress brain function. Opioids affect the brain's reward and memory centers, disrupting the white matter that connects different brain regions. This leads to slowed thinking, emotional flatness, and memory gaps. The longer someone stays on opioids, the more the brain adapts by shutting down vital pathways, resulting in a slow, quiet erosion of cognition. What you need to know. While opioids can provide temporary relief, their long-term use should be closely monitored. If you're prescribed opioids, it's crucial to regularly review your treatment plan with your doctor and discuss potential cognitive risks, especially if you're on them for an extended period. 2. Benzodiazepines. Next, let's talk about benzodiazepines, medications commonly prescribed for anxiety, sleep disorders, and muscle relaxation. Popular medications in this category include Valium, Xanax, Ativan, and Klonopin. Walter, 69, had trouble sleeping after his wife passed away. His doctor prescribed him a low dose of lorazepam. It helped at first, but within a few months, Walter started exhibiting strange behaviors. He began digging through the trash and putting empty yogurt containers in the freezer. His daughter thought it was just grief, but then he left his car running in the driveway overnight twice in 1 week. 3 years after starting the medication, Walter was diagnosed with moderate-stage dementia. These medications work by enhancing the effects of a neurotransmitter called GABA, which calms the brain. However, over time, benzodiazepines disrupt the natural balance of brain chemicals, especially when used long-term. Research confirms that benzodiazepines are linked to a 32% to 80% increased risk of cognitive decline, depending on duration and dosage. These medications suppress brain activity, which may initially help with anxiety and sleep, but, over time, disrupt memory formation and mental clarity. Long-term use has been associated with neuron shrinkage, disorientation, and even paranoia. The scariest part is that these medications are still commonly prescribed to seniors, often for years, with no warning about the long-term damage they may cause to the brain. What you need to know: if you're using benzodiazepines regularly, it's important to discuss alternative treatments for anxiety or insomnia with your doctor. Cognitive decline often goes unnoticed until it's too late, so being proactive about your health is essential. 3. Muscle relaxants. Now, let's discuss muscle relaxants, commonly used to relieve chronic muscle pain or spasms. Common drugs in this category include Flexeril, Soma, and Robaxin. 4 years before her diagnosis, 73-year-old Yvonne was prescribed cyclobenzaprine for chronic neck pain. Soon after, her family noticed strange behavior. She poured milk into a shoe, confused the pantry for the bathroom, and once asked if her grandson's toy dinosaur was the president now. At first, they joked about her brain fog, but the confusion deepened. Yvonne was eventually diagnosed with early-stage vascular dementia. These drugs work by slowing down nerve signals to the muscles to reduce spasms, but this sedative effect also slows down brain function. A major study published in 2020 linked long-term muscle relaxant use to a 36% higher risk of dementia. These drugs slow activity in the central nervous system, relaxing muscles but also reducing mental alertness. In seniors, the sedative effect is more intense and dangerous. Over time, the brain becomes accustomed to operating in a slower state, which dulls memory, awareness, and decision-making. What you need to know: if you're prescribed muscle relaxants, consider using them sparingly and for short periods. Long-term use should be monitored, especially as it can have profound cognitive consequences. 4. First-generation antihistamines. First-generation antihistamines, like Benadryl, are commonly used for allergies and sleep aid. However, they also pose significant risks to cognitive health, especially when used long-term. Franklin, 71, began taking an over-the-counter allergy pill every night to help with his sleep. At first, he thought nothing of it, just a common tablet from the pharmacy. But within a year, his son noticed he was repeating questions and even left his purse in the freezer, later insisting someone else had moved it. 2 years later, he got lost driving to his church of 30 years. By the time his memory lapses became undeniable, he was already showing early signs of Alzheimer's. Studies show that long-term use of first-generation antihistamines can increase dementia risk by up to 54%. These drugs block acetylcholine, a brain chemical critical for memory, focus, and learning. For older brains that are already low in acetylcholine, this suppression speeds up cognitive decline dramatically. What you need to know: consider avoiding first-generation antihistamines if you are elderly, especially if they are used regularly for sleep. Opt for newer generation antihistamines, which have fewer sedative and cognitive side effects. 5. Sleep medications. Sleep medications, including Ambien, Lunesta, and temazepam, are often prescribed for insomnia, but they may come at a significant cost to your brain health. Judith, 69, just wanted a good night's sleep, so her doctor prescribed her Zolpidem. Within weeks, her family noticed something strange. She was waking up confused, wandering the house at 3 a.m., and pacing back and forth in the attic. A year later, she began mixing up family members' names and using a fork as a hairbrush. At 71, Judith was diagnosed with mild cognitive impairment, and her decline hasn't slowed. A 2019 study published in the BMJ found that seniors who use sleep medications multiple times per week have a significantly higher risk of developing dementia. These drugs interfere with slow-wave sleep, which is crucial for memory consolidation and brain detoxification. Over time, they disrupt brainwave patterns, dulling cognition and accelerating neurodegeneration. What you need to know: if you struggle with insomnia, try non-pharmaceutical methods like cognitive behavioral therapy or relaxation techniques, which have shown better long-term results without harming brain function. 6. Statins. Statins, prescribed to lower cholesterol, are also linked to cognitive decline in seniors. Common statins include Lipitor, Crestor, and Zocor. 3 years before his diagnosis, 72-year-old Hank was prescribed high-dose statins after a routine cholesterol check. At first, he seemed fine, but soon he began pouring orange juice on his bed and claimed his wife's name didn't sound right anymore. The scariest moment came when he woke his wife up at 2 a.m., asking why the stairs were melting. Eventually, Hank was diagnosed with early-stage dementia. Studies show that high-dose statins may increase the risk of memory loss and confusion by 58%. Statins reduce coenzyme Q10, a nutrient essential for brain cell energy. Without it, neurons lose vitality, leading to cognitive decline. What you need to know? If you're on statins, ask your doctor about the potential cognitive risks and consider lifestyle changes like a healthier diet or exercise to reduce cholesterol naturally, if possible. 7. Proton pump inhibitors, PPIs. Proton pump inhibitors like omeprazole and Nexium are commonly prescribed for acid reflux and heartburn. But long-term use of these drugs is linked to cognitive decline. Mabel, 74, had been taking omeprazole for years to manage acid reflux. Suddenly, she started complaining of a metallic taste in her mouth, even when eating plain toast. She later began accusing her husband of burning food he hadn't even cooked. 3 years after starting PPIs, Mabel was diagnosed with early dementia. Studies show that long-term use of PPIs is linked to a 44% higher risk of dementia. These drugs interfere with vitamin B12 absorption and disrupt gut bacteria, which are essential for brain function. This disruption affects memory and inflammation through the gut-brain connection. What you need to know: PPIs should not be used long-term unless absolutely necessary. Consider alternatives for managing acid reflux, such as dietary changes or antacids with fewer side effects. 8. Antipsychotics. Antipsychotics, like risperidone and quetiapine, are prescribed for managing agitation and sleep issues. But in seniors, these drugs can accelerate cognitive decline. Leonard, 71, was prescribed quetiapine for agitation and sleep. Soon after, he began exhibiting strange behaviors, such as pouring maple syrup into miso soup and trying to open the microwave with a house key. His confusion deepened rapidly, and not long after, Leonard was diagnosed with early-stage dementia. Studies confirm that antipsychotics can accelerate cognitive decline, especially in older adults. These drugs block dopamine, a neurotransmitter vital for learning and focus. In older brains, this disruption can fast-track disorientation, memory failure, and emotional instability. What you need to know: antipsychotics should be used cautiously in older adults. If you or a loved one are prescribed these drugs, monitor any changes in cognition closely and ask your doctor about alternative treatments. 9. Tricyclic antidepressants. Tricyclic antidepressants, such as amitriptyline and nortriptyline, are often prescribed for depression, anxiety, and chronic pain. However, they can interfere with brain function, leading to memory problems and confusion. Delia, 75, was prescribed amitriptyline for chronic nerve pain. She began having strange episodes, such as washing her laundry with milk instead of detergent. Her family thought it was just the side effects of the medication, but soon, Delia was slipping into cognitive decline and was diagnosed with dementia at 79. Studies show that tricyclic antidepressants significantly increase the risk of dementia, especially when combined with other medications that affect memory. What you need to know: if you're on tricyclic antidepressants, discuss potential cognitive side effects with your doctor, and consider non-drug alternatives to manage depression and pain. Some medications save lives, but others quietly steal your mind before memory loss is even noticed. Most seniors have no idea. That's why it's essential to ask your doctor, is this still safe for my brain? If you or someone you know takes any of these medications, it's crucial to have a conversation with your doctor to assess the risks and explore safer alternatives. Recognizing these risks early can make a world of difference in protecting your brain health. Thanks for watching. If you found this information helpful, don't forget to share this video with others who might benefit from it. Make sure to subscribe to the channel for more videos on health, wellness, and how to protect your mind and body.